Hi, my name is Rachel Nakazi, and I'm posting my video on the desk guide that I have compiled for this class, psychotherapy class. It's been quite interesting. I have learned a lot. I happen to be doing my clinical rotation at the same time, and so it was quite eye-opening. I did quite have a lot of experiences with children with generalized anxiety disorders, and that this guide can be quite different between the adolescents, children, and adults, and the symptoms present quite differently. We did use the GAD, the GAD 7 score, with higher scores, being representative of higher levels of anxiety. We did a lot of psychotherapy as a first option, and it's been effective in children prior to doing a combination therapy with medications. We do see that in pediatrics it can be as fear, present as fear, worrying about something is going to happen to their parents or caregiver. Would assess for any bullying, any prior psych hospitalizations, any substance use abuse such as marijuana or weed, any alcohol. Are they safe? Are they being bullied at school? Do they have any friends? What do they keep doing during the day? Are they active? So, any recent trigger like a divorce happening in the family. I've seen that in my clinical practice, whereby children are getting very anxious, having to spend time alone with dad and time alone with mom on the weekends because of the recent breakup. So that is quite common to find. More so, it also kind of reminded me to kind of like just be aware that every child is individualized, and also it's important to kind of like identify if there is any underlying comorbidities that are contributing, hiding in and presenting themselves as anxiety in children. Same as that, like autism, same thing, with the sensory experiences. Do we have some other underlying mental health illnesses that are masking symptoms of autism or anxiety? So that was quite eye-opening. Any recent triggers like a sexual abuse or assault or loss of a friend or loss of a pet. So those are things we kind of like try to consider. Next, I did substance use disorders, alcohol use disorders, and PTSD. One thing that surprised me is one thing leads to another. Most of the time, substance use, rather PTSD, leads to substance use disorder, or substance use disorder like cocaine or heroin use can put somebody in an unsafe situation and lead to PTSD. So we would like consider things like some testing can be like the audit C, which is a testing for how often they are drinking, with again higher scores being a representative of higher levels of alcohol abuse. We usually ask questions like, what led for you to start abusing alcohol or substances, and any recent triggers, again, any access to guns, are you safe? Why are you here today? Are you ready to quit? Are you able to work with me? Can you promise me that you will not drink? If I start you on medications like ant abuse and these other medications that whereby if you drink when you're on it, you're gonna have like really significant effects, are you able to promise me that you're not gonna drink? So those are things we actually do consider. Those are things I would really include on my desk guide, that I'm not missing in a session where substance use is a problem. Again, we don't forget the support system, and have they tried any therapy before, and if so, what worked and what didn't? So that can be quite interesting, and I have enjoyed working with patients with substance use disorders, especially alcohol, and the reward that they feel they've worked so hard, they've come a long way, is really impressive. Other desk guide items that I looked at included suicide and self-injurious behaviors. Self-injurious behaviors, pediatrics present quite differently with cutting of wrists. I didn't have much of that, but I did have a pediatric who came in with suicide ideation, and the mother was panicking, of course, and became really anxious about it, ended up being hospitalized, inpatient, sectioned, and then eventually they presented to the office, and she surprised us how what led to her suicide ideation was that they found out she was she was only 12 years old, girl. Her parents found out she was doing marijuana and alcohol. So when we had a private confidential session after we talked to the parents, who were totally heartbroken about this, they did let us, the girl, the patient, the client, 12-year-old, told us that a cousin was supplying the marijuana, and to our surprise, she was stealing alcohol from her parents in the house, and that's how she was getting drunk. It was quite a challenge, and we had to keep confident